This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. As COVID-19 cases surge across the state, how are hospitals preparing for the second wave? Coming up, we talk to Yale New Haven Hospital about what it's seeing and doing to treat residents. First, the city of New Haven is among most towns and cities in our state that are seeing COVID-19 cases rising. New Haven Mayor Justin Elicker joins us with an update. Now, do you live in the Elm City? What questions do you have for Mayor Elicker? You can join us, 888-720-9677. That's 888-720-WNPR. You can share a comment on our Facebook page or find us on Twitter at Where We Live. I want to welcome Mayor Justin Elicker back to the show. How are you doing, Mayor?
I'm doing all right. Thanks for having me.
So we'll just start off. I wanted to hear how many COVID-19 cases you're seeing in your city right now, Mayor.
Well, since the start of the virus, we are now at 4,541 New Haven residents that have gotten COVID-19, and unfortunately, we've lost 121 New Haven residents. Like many places around the country, and also, of course, in Connecticut, we're seeing a significant uptick where the daily case rate is around 31 per 100,000, and our positivity rate is over 7% right now. So things are not looking terribly optimistic. Obviously, we're doing as much as we can to try to control this surge.
When you walk around your city, drive around the city, do you see most of your residents following the safety guidelines, where there's social distancing and wearing masks?
You know, I've been so impressed at just how many residents are following the guidelines. We see a lot of people wearing masks. A lot of the establishments are taking it very seriously. And I think that overall has been one of the reasons we've had relative success over the summer months. There's examples of people that are not abiding by the rules, and we've tried to crack down on a couple of businesses that, after many warnings, still haven't followed the guidelines that have been put out by the governor and myself. But overall, people have been really good at following the rules and keeping each other safe.
Now, when you have your briefings with your staff and your health director, when you see the cases rising in New Haven, why do you think that is?
I think there's a variety of reasons, but the primary trend that we're seeing is small gatherings, that people let their guard down when they're having a play date with a friend or getting together at someone's house with just a handful of people. We've seen some increase of cases related to people having dinner together, those sorts of things. And I think that people in general have been trying to figure out a way to live life and get that socialization, maybe expand their pod a little bit to help with childcare. And these small gatherings have really driven the increase in cases. And all it takes is one asymptomatic person in a group of 5 to 10 individuals, and all of a sudden we have a pretty significant outbreak. What's been interesting is we've seen no significant trend around the city of a certain population. It's been community widespread, and many people are getting it everywhere around the city.
Now, you can join our conversation with Mayor Justin Elicker, especially if you live in the city of New Haven. Here's the number, 888-720-9677, or find us on Facebook and Twitter at Where We Live. As a leader of a city, Mayor Elicker, you mentioned these these small gatherings that are happening that are leading to these cases surging in your city and also around our state. But as mayor, what can you really do about it?
There's a lot of things that we can do. First of all, I think the most important thing that our team can do and I can do is live by example and make sure that we're all following the same rules that we're asking everyone else to follow. And so our team has been very rigid about making sure that we're wearing our masks, especially when we're in opportunities where we could be potentially exposing other people. I'm very deliberate about always wearing my mask in front of the cameras as well. I think we've seen a lot of people take off their masks when leaders when they talk into a microphone. I don't think that's the right decision. I think we need to lead by example. The second thing is messaging. We are very proactive at making sure we're letting residents know when there's an increase in cases, what they can do to be a part of addressing the problem. And we do that through whether it's robocalls and text messages and emails and social media and talking with the press. I think that's a very important role. The third area is making sure that if we get reports of businesses or establishments that are not abiding by the guidelines, that we send our COVID inspection team out to work with the businesses to address the problem. And if businesses do not cooperate after multiple warnings, we'll take further action. As folks know, the governor ultimately has the power to shut down the business establishments more. Early on in the pandemic, the governor took that power away from municipalities, so we don't have that power, but I think there's a lot that we can do and are working on as a city to make sure that we're keeping residents safe.
Have you had discussions with the governor's office about what you'd like to do as a mayor of your city, maybe further rolling back the reopening? That's something that you have talked to the press about in terms of where we see the governor rolling back the reopening a little bit, but you want to see indoor dining halted in your city.
I have talked with the governor and his staff, and these are very, very tricky and difficult situations, right? They're decisions, because we don't want to impact the economy if we can avoid it. And the service sector has been very, very significantly impacted, in particular by COVID-19. I've made it clear that I think we need to be very, very proactive at this point early on in the surge. I think everyone is anticipating that these numbers are going to continue to rise, especially with Thanksgiving around the corner and what appears to be a lot of residents that will be traveling and will be gathering together with a larger family or friend group. And it seems to me that it's inevitable that we will have to close down some businesses temporarily. And it's better for us to be proactive and do that now rather than later, so that we get the case under control. And that in the long term will be much better for the economy, because we'll be able to open up faster and allow businesses to get back to some sense of normalcy. I think that one of the reasons we were so successful with this first surge is that we tightened up very quickly. And that allowed us to get the cases under control, and ultimately allowed us over the summer to start to open up restaurants and other establishments so that they could survive throughout the summer.
You said that you've had discussions with the governor's office. And so what are they telling you now as we're seeing this second wave around our state to be able to give you back that authority in your city?
I agree with the governor that we should do things on a regional basis. And I think that it would be unfortunate if New Haven were the only ones that took some of these actions, that it's important for us to do things as a region. I mean, New Haven is not an island, and Connecticut is not an island. I know the governor has worked hard to collaborate with other governors in the region to implement any changes together. And we've seen a lot of cases increase in other states around us as well. Rhode Island has been hit particularly hard recently, and they're going to be doing some tightening up after the Thanksgiving holiday. I think that they're in a tough spot, and are trying to do the right thing to make sure that we don't permanently lose some, for example, restaurants, but at the same time, try to keep things safe. I also think it's important to, focus on the data, and the data does show that there's a lot of small gatherings that are driving this. There have been a number of outbreaks associated with restaurants. The DPH, the Connecticut Department of Public Health, did an assessment of around 69 COVID outbreaks, and 20 of those were because of restaurants. And that's not to pick on restaurants by any means, but I think that we look at, for example, hair salons. We have not seen a lot of cases where there's individuals masked in hair salons. And so as we learn more about the virus, we should tweak how we tighten up and look to those places where we're seeing some outbreaks and other places where we may not be seeing them, and we can potentially keep some places open and keep and tighten up other places.
You can join our conversation with New Haven Mayor Justin Elicker at 888-720-9677 or find us on Facebook and Twitter at Where We Live. Someone tweeted, Mayor Elicker, it's a no-win with restaurants. Without state or federal support, I'm happy to order as much takeout as I can afford and to brave the patio and icy temperatures, but dining in is right now a personal nope. And so that is the question, right? How many restaurants can really afford to stay open, even with takeout? I mean, we really need support from the state and federal government here.
Yeah, it's just an impossible situation. On a regular basis, I talk with a lot of the establishments downtown, and people are really struggling to get by. The city's trying to help with promotion of marketing materials, takeout, and delivery. We've also, for folks that visit New Haven frequently, closed down a couple of downtown streets to allow for more outdoor dining and are open to exploring more opportunities if there's establishments that want to do that. As it gets into the colder months, it's going to be much trickier. And the individual that tweeted is right. This is an impossible situation, particularly if the federal government is not going to implement a second CARES Act. We're seeing in Europe, for example, a lot of countries that are actually paying restaurants and bars to stay closed. And I think it's very difficult for us to expect restaurants to tighten up at the same time that we don't give them any ability to keep going. So it's a very, very difficult situation.
And there is a wider effect when I think about so many people who go into New Haven to dine at so many of the great restaurants in your city. I mean, it has an impact on other businesses as well.
Yeah, absolutely. We actually do pedestrian counts over time, and we've noticed that particularly right during this first surge, there were almost no people that were walking around downtown, and that number has slowly increased over time. And it has not gotten back to pre-pandemic levels by any means, but we're noticing a lot more people that are out and about shopping. And I would encourage people, there's so much reliance on Amazon and online purchasing right now. I'd encourage people as much as they possibly can to buy local. These establishments downtown are part of the vibrancy of New Haven, and if we don't do our part to help them out by purchasing their goods, we're going to see a New Haven that looks very different in a year.
You can join us with Mayor Elicker, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Mayor, listeners are liking Twitter today, and Eric tweeted, with the closing of the downtown soup kitchen due to COVID infections there and the closing of the food pantry in Hamden, what is the city doing about food insecurity for residents?
Yeah, that was concerning. We saw that, and we're doing our best to make sure that the soup kitchens can stay open. I think we've seen some cases pop up. They'll close for a short period and then ideally open up. We've been working to do a lot around food distribution, and there's a number of areas we've been doing that. Obviously, school food is very significant, and even though our schools are currently in remote learning and have been so for since September, we've been doing food distribution at many schools around the city to make sure that people have access to food. We've also been doing larger distribution events that are kind of these pop-up events in many neighborhoods around the city. And they've been very, very popular, which is just an indication of how much people are struggling. We partner with United Way and a number of other groups to help distribute thousands and thousands of bags of produce to residents. We also deliver food to seniors if they need it. And people, if they have access to the internet, can look on our website. If they just Google COVID New Haven, they'll find a link to all the different food options that we have for residents. Because, at this time, people are really struggling with a lot of the basic needs, and it's very, very important that people have access to food to get by.
You can join us with Mayor Justin Elicker of the City of New Haven, 888-720-9677. Miriam's calling in. Miriam, what's your question?
Hi, good morning, Mayor. My question is that CT Transit is the last transit agency that does not have a mask enforcement policy, where if you're not wearing a face mask, you will not be told you have to put on a mask or get off the bus. So passengers can board buses without masks on, aren't necessarily offered a mask, aren't necessarily told you have to put on a mask or get off the bus, and they can ride unmasked. And then that means some people who are high risk don't feel comfortable taking CT Transit buses right now. What is your take on this, and improving mask compliance on the buses, which has gotten better but is not 100%?
This is a great question, and I think a lot of listeners and Miriam, I'm sure you know that the state of Connecticut manages CT Transit, but that doesn't mean that the city can encourage the state to change their policies. I actually think that it puts the drivers in a very difficult spot, and this is why CT Transit has not asked the drivers to enforce the mask policy. From time to time, there are incidents on buses, and the driver should be focused on driving the bus and not intervening and potentially creating a situation that might not be ideal. But I think the suggestion of having masks available for people to use if they get on the bus is a really good one, and I will certainly pass that along to the state.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We'll continue taking your calls for Mayor Justin Elicker, who leads the city of New Haven. Here's the number again, 888-720-9677. You can find us on Facebook and Twitter at Where We Live. We'll be back after a short break. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We're checking in with New Haven Mayor Justin Elicker today. If you live in the Elm City and have a question, you can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. We have the mayor for the next 10 minutes before he heads off to a meeting. Elisa's calling in from New Haven. Elisa, go ahead.
Hi, thank you so much for taking my call. So my question was, I'm recently recovering from COVID. I had a moderate case. I was really sick. And while my doctor, made it clear they were taking care of me, I didn't receive any instructions about how to reach out to people I may have been in contact with, or any kind of follow-up with contact tracing. And I was just wondering what the plan was in the city for positive cases, for contact tracing, if maybe I fell through the cracks, or is there kind of a bigger system-wide support for that?
Thanks, Elise, for this question. And if you're a New Haven resident, if you could text me at 203-500-2969 just to give me some more details on it. In the beginning of the pandemic, we had a lot of school nurses that were doing contact tracing to help support residents like yourself. And the state has taken over some of that contact tracing, but we're actually, because the schools are not in session, activating more nurses to do this. Obviously for everyone, contact tracing and helping support people that are in your situation are very important. It surprises me to hear that you were not contacted, and it would be very good to actually get down to the bottom of why. So if you could text me or call me, that would be great. Thanks.
And we'll send her number to your spokesperson, Mayor Elicker. Can we talk more about the school children in New Haven? Many of them not actually in a classroom since the spring. There was a plan to go from remote to, I believe, hybrid, but that had to be halted because, again, of this COVID-19 surge. And I'm just wondering, what are your thoughts on reaching children, especially those in need? We know that we've heard from our commissioner of the State Department of Ed, Miguel Cardona, and others, that school sometimes is the safest place for children.
Yeah, this has been such a tough challenge. It's in many ways similar to restaurants where it's an impossible situation. Dr. Tracy, the superintendent of schools, and I were vocal advocates of opening up when the cases were low in September. And understandably, there were some teachers that were and other staff members and some board members that were concerned about opening up. Because of the risk that people felt existed in schools. Overall, the indications are that in the younger ages, the likely spread of the virus is relatively low. We were seeing a lot of cases, even with our schools closed. Our staff members were coming into the schools and teachers, and we were seeing a lot of cases coming into the schools and exposing different individuals in the schools because of that. And as the cases began to rise, we felt like it was not the wisest decision to start the hybrid model. As a parent, it is very, very challenging to have a child at home doing online learning. I think that the online learning program that New Haven Public Schools is implementing has vastly improved, but it's incredibly challenging for parents. My wife and I struggle through it, and frankly, we have much more ability to make things work than a lot of parents, where they may be a single parent that has to work. They may be two parents that have to work under very challenging situations. Maybe you have 3 or 4 kids at home all trying to do online learning. I think the positive thing is that every child in New Haven should have a device and access to the internet for free at this point, because the team has worked very, very hard to make sure that they have that infrastructure. And my hope is, as the cases go down, we'll be able to get back to in-person learning, which is so vital for the success of so many New Haven kids and their success.
You said that the online learning instruction has improved from the spring, but do you know how many New Haven public school students are engaged, are actually connecting and doing the work, Mayor?
The vast majority are, but there's still some students that are not actively engaged, meaning they don't log in frequently, but they log in sometimes, and then some that haven't logged in at all. Our team has been actually going door to door to those kids that have not been engaged, and teachers and principals are working to find the reasons for kids in their classrooms not being engaged, and see if we can support them to make sure that they are more engaged. It's a bad situation. It's a tough situation, and I think that all of us would admit that. This is not ideal by any means, but we're working hard to try to get the kids more engaged.
Mm. The mayor will be with us for another 5 minutes. So last call on questions for the mayor at 888-720-9677. I have to ask you about testing, Mayor Elicker. I wanted to know about the amount of testing sites that your city has, and what kind of oversight do you have when you are partnering with providers? I'm asking this because there was an early partner, Murphy Medical Associates, which has been a source of many complaints from patients for exorbitant billing. This is something New Haven Independent reported on, and it was picked up by the New York Times, who recently investigated. I know that they're no longer a partner with the city, but can you talk about how you go about getting people and providers to have testing for your residents, and what kind of oversight you have?
Sure, and just to be clear, no patients were billed by Murphy directly. It was the insurance companies. Nevertheless, we had enough concerns about it that we decided to go in a different direction. We've worked very, very hard to increase testing capacity, and currently are working with 5 different organizations to facilitate testing around the city. Overall, I think that partnership has been very, very successful. We are working both to have sites that are regularly open to implement testing. In particular, Yale New Haven Hospital, Fairhaven Health Clinic and Health Center, and Cornell Scott have all been doing regular testing since pretty early on in the pandemic. But we've also had a lot of pop-up events, whether it's on the Green or yesterday at Columbus School in Fairhaven, there were over 300 people that got tested. We're seeing, like many other large municipalities, a surge in demand for testing. Frankly, the surge is both associated with the increase in number of cases, but also because a lot of people are planning on traveling for Thanksgiving and are trying to get tested before that. But we're working very hard to increase those numbers. And of course, very cognizant of any complaints that anyone might have with any testing facility, and we're on top of that. For example, there was an organization that was doing testing not in New Haven but all around New Haven, and they weren't properly reporting the data to the state. And we work with the state DPH to make sure that that was fixed, because it's important for us to know the numbers.
You mentioned a surge in demand in testing. What are wait times looking like in your city?
It wildly depends on, in particular, if people are symptomatic and talk with their healthcare provider versus if people are asymptomatic and need to schedule a test, and it might take a little bit more time. But generally, it's probably a maximum of an hour wait, but it depends on the site and the time people show up.
We know that municipal leaders have a lot of challenges outside of COVID, including budgets. And I understand the city has an estimated $13 million deficit for the coming fiscal year. The New Haven Independent reporting that you've appointed some people to work with Yale to see if the university could provide more to your city. What can you tell us?
We face even before the pandemic, we are facing a fiscal crisis in the city of New Haven. This past year, the gap between revenues and expenses just to keep business going as normal was over $30 million. And we're likely to see each coming year be similar to that. The pandemic has exacerbated that problem. We've had significant increased expenses, in particular around police and fire overtime. Our fire and police officers are first responders, and we've seen an uptick in violence in the city as well. And we've seen a decrease in revenues, particularly around parking meters and parking tags. And that's created a pretty challenging financial situation. We're working through this, but ultimately, we can't solve these problems by cutting and cutting and cutting. We need our partners at the state and Yale University to help out on the revenue side, or we're going to have to continue raising taxes to a level that is not sustainable. So it's a very, very challenging situation. And I think it's frankly a time in these conversations about systemic racism and income inequality where we need to see our partners do much more to live by often what they talk about of addressing the challenges of the communities that are most struggling. And
so just to clarify, Yale University, their voluntary contributions is about $12.5 million.
It's around 13. It's a little over 13 million.
But you would like to see it up to 50 million. Is this something that you want to see in the next year? Can you tell us a little bit about some of the talks that you're having?
Yeah, absolutely. I think that with a university that has an operational budget that is many times the size of our city's operational budget, the $13 million contribution to the city is way, way under what we would receive, which is over $150 million if Yale were taxed. And it is a drop in the bucket compared to what they can afford. It's in the self-interest of Yale to be located in a city where everyone has the opportunity to thrive, where we can pay for a librarian and guidance counselor in every school, which we currently can't. But it's also their ethical responsibility. And our conversations with them have been pushing them in that direction. My hope is that the leadership of the university will understand that now is the time to demonstrate that Yale is a leader when it comes to addressing income inequality and systemic racism.
I want to thank Mayor Justin Elicker for joining us here on the show. We'd love to have you back in a few months, Mayor.
I appreciate it. And I would just urge people again, as Thanksgiving approaches, it's critical that we ensure that we're not expanding our groups because we need to get this virus under control. So think twice when you expand, or you're thinking about expanding that network over Thanksgiving.
We hope you have a good one with your family, Mayor.
I appreciate it.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up after the break, we find out how Yale New Haven Hospital is doing as cases surge in and around the city. You can join us too. Do you have a question about going to the hospital during a pandemic? 888-720-9677 or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. We know Thanksgiving is this week. What's it going to look like at your home? On the next Where We Live, we focus on gratitude. Despite this being a chaotic, hard year, we want to hear what you're thankful for this year. Join the conversation. That's tomorrow. Now, we know hospitalizations are up as COVID-19 cases rise around our state. Joining us now to talk about what their hospital system is seeing on Zoom, Michael Holmes, Senior Vice President of Operations at Yale New Haven Hospital. He's also the hospital's Incident Command Officer. Michael, welcome to the show.
Thank you, Lucy, and good morning.
Also with us, Dr. Lauren Ferrante. She's a pulmonary and critical care physician who cares for patients in the medical intensive care unit at Yale New Haven Hospital, and she's also faculty at Yale School of Medicine. Dr. Ferrante, welcome to the show.
Good morning, Lucy. Thank you for having me.
So I'll start with you, Michael. We know that Governor Lamont and others, when we think about cases rising, we think about hospital capacity. And so tell me what you're seeing at your hospital.
First, let me thank all our clinicians and our support staff here at Yale New Haven that take care of our patients on a daily basis. Today, although we are seeing an increase in our COVID inpatient volumes, we have ample beds to take care of our patients. In our hospital today, we have 210 COVID patients across our entire system from all throughout Connecticut. We're up to 390. That's about halfway, Carmen, of our first experience that began in March, April, and May. We've learned a lot from the first time that we went through this COVID wave to the second wave. And I'd just like to echo what Mayor Elicker said this morning. He and Governor Lamont have been very, very positive in working with our clinicians, our scientists, to bring the most expertise data to our state. He mentioned several things that I would encourage us to continue to do: wear a mask, physical and social distancing, making sure you're washing your hands, and most importantly, let's curtail these big Thanksgiving activities that I know that we all want to do. As the second largest hospital in the country and the largest safety net hospital in Connecticut, we're well prepared to take care of this next COVID wave. But it's going to take all of us working collaboratively together.
Now, Michael, you mentioned that you have ample capacity, but when we think about your hospital system, I believe Lawrence Memorial Hospital in New London is part of that network. What are they seeing? Because we know that cases are rising on the eastern side of our state as well.
Yeah, one of the great things that we did through the first wave is we have a dashboard that I'm actually looking here off my side, so I can see the COVID volume, I can see the overall census at L&M, as well as Westerly and Rhode Island. We watch very carefully, in particular, the ICU volumes. We will transfer patients to make sure that we maintain safety at that hospital, as well as with the expertise that we have here. So we have a very good handle on all of our COVID populations in our hospitals across our system and mechanisms to transfer where we need space available.
Now, Dr. Ferrante, I mean, it sounds like the Yale New Haven Hospital and its partner hospitals are in a good place, but with cases rising, can you talk a little bit about some of your concerns over the next month, especially after Thanksgiving?
Yeah, so as the mayor and Michael just mentioned, I too am very concerned about what we're going to see after the Thanksgiving holiday. I'm worried that families are going to host extended family in their home, and that Thanksgiving will end up being a super spreader event. And that this is going to result in an increased demand in our hospital system. And so just to echo what's been said already, I would really encourage everyone to please just celebrate Thanksgiving with those who are already in their household.
When you think about when you see the patients this time around, Dr. Ferrante, what can you tell us about them in terms of their age? Because in the beginning of this pandemic, there's a lot of attention, of course, on the elderly because of the risk factors. But I'm wondering what you're seeing today.
Lucy, that's a great question. And one thing that I do want to emphasize that applied both to the first wave of the pandemic and this one now is that the virus really does not discriminate in terms of age. So although, yes, we did see patients who were older and who had more comorbidities, ending up severely ill more often than younger patients. I took care of many young patients, and I have taken care of many young patients in their 30s, all the way up through older ages. And I really want the public to know that this virus does not just make older people and those with comorbidities sick. Everyone has to be careful. And the other thing that I'll note is you've probably heard a lot about the long haulers, quote unquote long haulers, where even if someone has survived having COVID or may or may not have even been hospitalized, many patients are left with lingering symptoms for months afterwards. And we really don't know why this is happening to some versus others. The science is still evolving in this area. But I also see those patients in clinic, and I can relate to you that many of those patients are actually on the younger side. So despite what we've seen in larger cohort studies, as I said, this virus really does not discriminate in terms of age. So we all need to be careful.
This is Where We Live. I'm Lucy Nalpathanchel. With us, Dr. Lauren Ferrante, a pulmonary and critical care physician who cares for patients in the medical intensive care unit at Yale New Haven Hospital, and she's faculty at Yale School of Medicine. Also with us, Michael Holmes, Senior Vice President of Operations at Yale New Haven Hospital. If you have a question, especially if you live in these areas that Yale New Haven operates and serves, you can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Dr. Ferrante, looking back to March and April, there was a lot about this virus that wasn't known. But can you talk through, now that we're hearing, again, the governor and others saying that the good news is for people who are being hospitalized, we're not seeing as many deaths. And can you walk us through some of the treatments or medicines that hospitals are now using because they've learned a lot from that first wave?
Yes, absolutely. So we really have learned a lot since the first wave, which is encouraging. I think it's important to highlight 2 medications and also 2 treatments that we now have evidence for, or at least more evidence than we did at the beginning of the pandemic. So the first thing, which is a treatment, is that we know now that we don't have to put patients on the ventilator as early as we thought we did at the beginning of the pandemic. We know that we can use high flow oxygen devices, and that many times this will be enough to help patients where they don't need to go right on a machine to help them breathe. We also know that proning patients, which you may have heard to referred as tummy time, or having someone lie on their belly as opposed to on their back, can improve oxygenation for patients who have COVID. And that's something that we knew improved mortality in non-COVID patients with what we call ARDS, or an inflammatory lung condition. In the past, we knew about that, but now we know that proning does improve oxygenation in COVID patients. So we do encourage that among our hospitalized patients. In terms of medications, we now have pretty solid data for 2 treatments in the hospital. The first one that deserves the most mention is dexamethasone. So dexamethasone is a steroid. And we do have evidence now from the recovery trial that this decreases mortality in patients who have severe COVID, which is defined as those who need oxygen. And the second medication that we're giving in the hospital, and we had used in the spring, but now we have better evidence for this, is remdesivir. And that's an antiviral that has now been shown to decrease the time to recovery for hospitalized patients. So although we didn't see a mortality benefit, it does improve the time to recovery for those in the hospital.
Michael, we're hearing from some listeners on Twitter. One writes, the Yale New Haven COVID hotline doesn't handle the Yale New Haven pop-up COVID testing sites. People looking to get tested at the pop-ups wondering who to call for help. What can you tell them, Michael?
That's a great question. So we partnered, as Mayor Elicker said, with a variety of providers across the community. Fairhaven, Cornell Hillscott, our NEMG, our Northeast Medical Groups all have testing capability, as well as our partnership with Physician One. But the COVID hotline will make sure that you have all the contacts for those resources.
But this person's saying that the hotline doesn't handle the pop-up COVID testing sites? Where would they get that information?
They should have that information,
Okay.
or they should be able to provide that person who is tweeting that information with that. So I can go back and double check to see if they don't, if they're not sharing that information.
If you have a question, you can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. Someone else wanted to know, Michael Holmes, that they scheduled a mammogram in August at Smilo that won't be until February. The only way to get it sooner was to have it somewhere else. So what are you doing about the long waits for mammograms?
Yeah, they bring up a very good point. And, one of the things that we did in order to manage our first wave is unfortunately, we had to delay quite a bit of care. We've extended our hours for mammography services in particular, not only here on our St. Rayfields campus, but in North Haven, as well as our Shoreline facility. We work with our YM providers to make sure that even we're offering weekend schedules on that. And we are trying to work through that backlog of patients that have been waiting patiently to get in to see us.
Seeing overall that people are again maybe postponing some regular checkups and appointments because they might be afraid to go to the hospital. Michael, what can you tell them?
We follow all the best practices from the CDC and learnings that we've learned through, our first wave. We've done some things in particular to make sure that we send great messages to our community. We had limited visitation policies. We test regularly all symptomatic employees. We have a whole department that does contact tracing should we have any breakout in the hospitals. We have the best cleaning protocols out there, and we've learned through wave 1 and we've implemented those wave 2. So I feel very confident that we offer very safe services. We're encouraging the community, should you need our services, please seek our care.
I was thinking, for people who may have COVID but don't know it because they're asymptomatic, are there instances where someone's coming in to the hospital or one of your partners and they're getting tested because it's routine and they're finding out that they're COVID positive?
Yeah, I think that this is another important thing that we've learned from wave 1 to wave 2. And Dr. Ferranti excellently talked about the treatments and the medication that we have. But one of the things that we're also seeing through the second wave is a lot of people are showing up for service. We test all admissions that come through our emergency department. And we have a lot of patients that are showing up with non-COVID related asymptomatic symptoms that we test to ensure that they don't have COVID and they're showing up positive. So I think the community spread is something that is very important. It's very serious out there. That's something that we're seeing is people are not showing up so much with COVID symptoms, COVID diagnosis. It's in addition to what, they're showing up for.
Dr. Ferranti did a great job walking us through some of the treatments and medication that providers are now using regularly from learning from that first wave. But I am wondering, from the first wave, we knew that there were PPE shortages early on. What does it look like now for your team at Yale New Haven?
Yeah, thanks for asking about this. This is such an important issue. The situation right now with regard to PPE is so much better than it was in the spring. I think that the decline in numbers over the summer gave everyone a chance to catch up and to prepare for what we thought might be a second wave during the winter. And so the health system has, really prepared where, in terms of the first type of N95 that had been used for many years, with that supply chain running low, we are prepared now with backup N95s, so different types of respirators that are being made that still provide the same type of infection. And many of the providers in our medical intensive care unit also received a certain type of respirator that can be cleaned by the hospital and then given back the next day, completely clean and ready for use. So overall, I would say our PPE situation is much better than it was in the spring.
Can I ask you, Dr. Ferrante, how your team is doing? We hear a lot about COVID fatigue for people who are not health professionals, but I was thinking about, seeing these cases rising, the toll it takes on you and your team, as well as the fact that they have to quarantine from their family.
Yeah, thank you for asking about that, Lucy. So I will say there's, in the spring, I think there was a lot more adrenaline where everyone, really felt that, we were heading off to battle in some way. During the second wave, we still have the same motivation and desire to help our patients. I think everyone is a little bit more tired, but no less motivated to help and to take care of everyone. I think we do wish we had suspected that there would be a second surge in the winter. I think we had hoped it would not have started this early, where we really started to see numbers rise at the end of October, beginning of November. But on some level, we knew it was a possibility because the numbers never got to zero over the summer. So we felt it was probably just a matter of time before they went up again. But we are, we're all trying to take care of ourselves. There are several different mechanisms that we're using that the hospital has provided and that our group has organized to support staff. So things like stress and resilience meetings, and just trying to support each other.
That's good to hear. Before we run out of time, Michael Holmes, I'll turn back to you. Everyone's looking to the good news from Pfizer and Moderna about these vaccines and the fact that they're over 95% effective. But distribution is going to be the next challenge. What can you tell us about Yale New Haven Hospital working with the state on this distribution plan?
Yes, it is good news. And I think we actually heard this morning that there was a third update out there, which we're excited about that. We do have a variety of our clinicians and our physician leaders that are working with Governor Lamont and a statewide committee that's looking at how many vaccines we're going to get, how they're going to be distributed in the most safe way. I don't have too much more information at this time, but there's a lot of smart minds around the table to get the vaccines to the essential folks in the quickest time possible.
Meanwhile, Dr. Ferrante, still not too late to get a flu shot.
It is definitely not too late to get a flu shot, and we encourage that everyone gets the flu shot. Yes, absolutely.
I want to thank Dr. Lauren Ferrante for joining us again, a pulmonary and critical care specialist who cares for patients in the medical intensive care unit at Yale New Haven Hospital. Dr. Ferrante, thank you.
Thank you so much for having me, Lucy.
Also here with us, Michael Holmes, Senior Vice President of Operations at Yale New Haven Hospital. Michael, we thank you for your time today.
Lucy, thank you as well, and have a great day.
Again, today's show, produced by Carmen Baskoff. Our technical producer is Kat Pastor. Again, tomorrow our show is about gratitude. We want to hear from you. Join us. I'm Lucy Dalpathanchel. Thanks for listening.